Hi, this is Dr. Sperling. You know me as Dr. Nail Nipper, and while we're all going through this very unusual, unprecedented time in the world right now, and many of us are under shelter-in-place and stay-at-home orders from the government, I would like to take a minute just to talk to you about some of the issues that have come up for some of my patients, and some ways that maybe we can help you deal with these issues at home. The two biggest issues that I have heard from people are arch pain, heel pain, and ingrown toenails. And we are doing telehealth visits from my office now, but I wanted just to give you a little bit of insight on some things that you could do at home that might help. So anybody who is having anything from big toe joint pain to arch pain, heel pain, plantar fasciitis pain, the first thing I ask people is, what are you wearing on your feet while you're at home? And mostly the answer is slippers, socks, or nothing. And if you're not wearing anything supportive on your foot, then that can be why you have a lot of these pain problems. So the first thing that I will tell people is to get into some good athletic shoes that have good support and stay in them even around the house, because that will help a large number of these problems. If it doesn't, while most people don't need a custom orthotic, we do have these over-the-counter orthotics that are called ped pillows, and you can find these on our website. And they come in women's and men's. I know, little sexist, but purple and black. But these can help if just wearing your shoes is not enough. Now, these usually are available only through the provider's clinic. Like, you'd have to come in as a patient to get it, but the Ped Pillow Company has allowed us to put these up online so that people can get them from home and you can get the mail order. So that would be the first thing for any of those pain issues that I would recommend that people do, and ice, that would be the other thing. The second most common question I get is about ingrown toenails, and while this may not be considered urgent, it can be quite painful and concerning, especially for patients who may be diabetic or otherwise immunocompromised. So the first thing that you can try and do at home is to soak in some warm salt water for about 15 minutes and apply some topical antibiotic ointment. In our country, I know we have Neosporin, bacitracin. Every drugstore and Target has their own generic triple antibiotic ointment brand, and any of those are fine. I recall when I was in Australia, they don't have it there, and there was a hydrogen peroxide cream that you could get. So anything that's antibacterial that you can put on after you soak would help. If for an ingrown toenail that could lead to an infection, I would consider that urgent enough to call your provider and have them take a look at it. So I hope that everybody is staying well and safe and has not been adversely affected, and our hearts go out to all of those who have. And please sit back and just enjoy a little bit of nail cutting and conversation. Thanks. Okay, any new problems with your feet?
No, but I do want my toenails removed, but I don't know when yet.
Not today, okay.
Well, no. I don't know how much it costs, so.
The big toenails, it's covered by insurance.
It is totally covered?
Should be, unless you have a big deductible with your Medicare plan. But it's not considered cosmetic. It's elective, but it's not cosmetic. So if that's something, it's a procedure that is covered by insurance. It's not considered cosmetic. That's what they won't cover is cosmetic stuff.
I have to work today, so I think maybe I'll skip it today.
Oh, we're not going to do it today anyway. We need more time than regular.
Do you do it on certain days?
Whatever works.
Okay.
And all I do is, if it's this nail, I numb the toe back here.
Like you did the last time?
Exactly how I did the last
That's
time.
how much is growing back since the last time I came in.
Okay. Yeah, I think for you it would be probably a really good option.
Yeah, I liked it when I had no toenail there.
No nail, yeah.
I really gotta be good because she's filming this.
I can edit out swear words, it's okay.
I don't swear.
I know, I'm kidding.
I might think them. No, I don't swear. Okay, my next question is,
Yes.
the second toenail is also a bear.
On each foot? Mm-hmm.
Would that be an option?
Yeah.
Would you recommend it?
Well, if this is painful every time you come in, and if it hurts in shoes, then yeah, I mean, I think that that would be reasonable.
I don't know if I... You know what hurts is the top of my toe. Where it rubs.
Mm-hmm.
I have to
Oh,
be
up
sure
here?
I get, yeah.
Okay.
I have to be sure that I get a shoe that's got enough room in it.
Mm-hmm.
Yeah, this one isn't a painful one.
Is or is not?
Huh?
Is or is not?
Is.
Okay.
But maybe it won't be quite so bad because it's not,
Because there's not so much of it. This is all skin up here that I'm trimming away.
yay.
And that's just a bunch of dead skin. Big chunk. We like getting big
I
chunks.
noticed.
Okay. So there's not so much to trim on this nail. I'll probably get most of that just with the sander.
Yay. I'm surviving this. This is better than usual.
Right, because there's not as much nail, so it's
Yeah.
not so painful.
Wow. Then I don't like being photographed. Videoed or whatever.
Well, you know, and you're welcome to say no too.
I don't care.
Okay.
I don't care.
So how have you been?
Well, I went to Colorado for Christmas and
Oh,
caught a cold for my son.
Okay.
And it turned into bronchitis. I have been so sick for, in 3 weeks, three and a half weeks, I only worked 2 days, which is like
For you, that's like close
unbelievable.
to death. Yeah.
And, but I think it brought out the problem I'm having with my ear, because I've gone to the ear doctor, they say there's nothing wrong.
Mm-hmm.
I don't have wax in my ear, but yet I've got stuff moving around in there all the time. I wake up some mornings and can't hear my phone, or the water, or anything. It's those things are moving around,
Mm-hmm.
and I'm sure it's middle ear.
But the ENTs say they can't find anything?
They even had me go to a physical therapist. They said I didn't have vertigo.
What?
But when I talked to the Dizzy and Balance Center, they said that they have other tests that are a
Yeah.
little more extensive,
Right. Good.
and it has gotten worse. So maybe it'll show.
So you're what?
I fight it every day.
The dizziness?
Dizziness, well, it's not dizzy, it's lightheadedness. My head doesn't go with my feet.
Has it affected your driving at all?
No,
Okay.
when I'm sitting down, I'm great.
Okay.
It's just when I get up and move, which is most of the time.
Yeah. Yeah, you are not somebody who sits. I do know that. And when's your appointment there?
The 3rd, I moved it up from the 11th. They made room for me earlier
Wonderful.
because I called and told them I was having. Yesterday I woke up, I couldn't hear water running.
Mm-hmm.
I couldn't hear my phone. My phone is the most irritating ring in the world,
Mm-hmm.
and I couldn't hear it.
Mm.
So I was a little upset yesterday because I thought, gosh.
So that's next week then, is your appointment?
So when I called them and I told them that I couldn't hear anything, they moved it up.
Did you have to call them through the deaf relay? Just kidding.
Through
The deaf relay?
No, no. Are you going to get another dog?
Another dog? Well, my second dog, since we said goodbye to the other one. He
What?
Has, Since we said goodbye to one of the dogs, my other dog has been the happiest I've seen him in years.
Really?
Yeah. Which I thought was kind of an odd
I
reaction.
would think he would be lonely.
I would think so, but he's been very happy being the only one. Sorry. And my daughter reminded me that when we brought the second dog home, because he was there first, she said, "Don't you remember that when we brought the second dog home, he ignored you for a week?" And I had completely forgotten that. He did not want another dog there. So he is not sad and mopey. So no, I will not be getting a second dog.
That is funny. I would think that he would really miss him.
I would think so, but no. He's a much happier boy, which is very weird.
Well, they were both 13, weren't they?
15.
50.
He's in his 15s, and she was also 15.
Oh.
So, yeah, it was very hard. I've never gone through that with a pet before. Just about killed me.
Well, I have,
Yeah.
and I know how hard it is. Of course, I've had pets all my life, and I said that was the one bad thing about pets. They don't live long enough.
Well, now that I'm in my 50s, I figure if I get a baby African parrot or something, it'll outlive me, right?
Probably. They live long.
Yeah, I'm kidding though. Yeah, it broke me for a little bit. Having to say goodbye.
I had a cockatiel, but I don't know if I'd have anything bigger than a cockatiel, because they can really hurt. I don't know how big a baby African parrot is. They can't.
And I don't know, I was just kidding.
This is the good part.
I'm sorry, is that hurt or is that just a vibration?
No, it hurts. Like it hits a tender spot.
Oh, okay.
Now that's just a vibration.
Okay.
But I am going to have them removed. I got to debate whether I want both of them removed on each foot. Are you taping everybody? Are you taping many people?
Quite a few.
Sorry. that long, 3 months for that to grow in.
Yeah.
Something on that toe. Little spot. Is that a hammer toe? The second toe, is that a hammer toe?
Yeah,
Okay, does that get bigger as
it can.
it does, huh?
It can. It does, but it can. You know, the best thing you can do to help prevent it from getting bigger. How's that feel now here?
Good.
Good. And over here?
Good.
The things that you can do to help prevent it from continuing to get bigger is to wear, you know, the good shoes with good supports and orthotics. And then we also have a little splint, if you want to see it, that just goes over the base of the toe and holds it down.
I would like that because it does affect me when I'm
Okay.
wearing certain shoes. And yeah, I know I'm supposed to have orthotic shoes, but I also have shoes that I wear for dress. And
Yeah. So let me just go grab the splint, and are you thinking one for each foot?
for each foot, both toes hurt. Just those
Okay.
second toes.
Okay, let me go grab a couple. I will be right back. You can keep running.
Okay. Are you doing this for a school project?
No, my grandma actually comes here, so it was just happenstance that I heard of this job and decided it would be interesting, so.
Oh, so they hire you to do that?
Mm-hmm.
Wow, that's neat. I thought maybe it was a school project that you were
Oh.
doing.
No, I just was running out of videos, so I needed someone to come in because I can't keep taking my receptionist away from the front desk. So, okay, so this is the splint, and what it does is it goes over this toe, and it goes all the way back. It has to go behind that first knuckle there. Then you just snug it down a little bit, and then as you walk, do you see how that's going to hold it down?
Wow.
So I can give you one for each foot, and just know that the elastic on this is kind of stiff. So it may take a little bit of time to get used to it. Usually it's like a week before you can make it all the way through the day with the splint on. And again, it goes down, it has to go past that first knuckle. And then just snug, you don't want it tight because we don't want to cut off your circulation, but that will hold it down.
How do I know how snug to make it?
How it is right now. Not tight, just how I have it right there. So
Wow.
it's not going to stop the hammer toe from getting worse if that's what the hammer toe is going to do. But what this will do is it'll hold it down away from the top of the shoe as you're walking
That's
so that you
super.
don't have the pain. Okay?
Yeah. I have seen those,
Yeah.
but
And-
I've never used
And they
them.
work really well for various things, but yeah.
That's
Okay.
nice.